dental care. Okay, why the dentition is so important in case of horse compared to other animals? We never talk like in case of cattle, sheep. We talk up to the eruption of permanent teeth. After that, we don't discuss much about the dentition. But in case of horse, it's very important, as here horse may survive more than 7 years, 8 years, 10 years, 12 years in case of breeding or stud farms. Okay, so sometimes to bring down the age of the animals, they do a lot of manipulation in the tooth, either on the incisors or in the molars, mostly on the incisors. So that's why dentition in case of equine husbandry or equine field, it's very important. Okay, so why it is important? For the selection and purchase of the animals, for fixing the price of the animals, for fixing the dose of the medicines. This is basically alternative. Otherwise, if you have a proper record, no need to depend on the dentition. But these are all a second line of information. Okay, this is secondary data, what we call it as. So estimation of age in case of absence of records for judging the performance and the performance of the animals, particularly in the field conditions. Okay. Then what is dentition? It is nothing but a study of configuration and conformation of the teeth with special reference to their periods of eruption through the gum. Means when the temporary tooth will fall and permanent tooth will erupt. Okay. And how frequently they erupt. Okay. And how many are present, both configuration and conformation. Kitna hona chahiye aur kitna hai. So that is nothing but configuration and conformation, which we tell it is a dentition. And the whole description of that table is called as a dental formula. Okay. So eruption means we're cutting out or coming out of the gum. We call it as a eruption. Okay. So generally, in respect of species, there are two types of tooth: temporary tooth, or we call it as a milk tooth, and also permanent tooth. So if you take the dental formula, okay, so in case of male and female, it's different, but you all already studied in your UG program. I'm not going in detail. So mostly 3 incisors present on the upper and lower jaw. So no canines in case of female. Okay, 3 or sometimes 4 molars, and molars are fixed 3 and 3. Okay. So in case of male, 1 canines will be present both on the upper jaw and lower jaw. They are also called as tushers. Okay. So this is a dental formula. Now, how estimation of age is done in case of horse? As in case of horse, the age even behind 8 years. Generally, we in case of race horses, we call them after 5 to 8 years. We call them as age horses. Means they are no more fit for the race purpose. However, their good pedigree means they may be used for the breeding purpose. In that case, even estimation of age behind 8 years also is equally important. Okay. So that's why age estimation is generally done by the first and simplest is eruption of teeth. But it has some limitation. After eruption of complete all the incisors, then there is no more it is useful. Okay. So in case of horse, it is 2.5, 3.5, 4.5, maximum 4.5 years by eruption you can tell. Okay. But subsequently, there are other methods: wear and tear of the mark or infundibulum, okay, appearance of the dental star, angle of upper and lower incisors, appearance of galvin screw, and also shape of the table surface. Okay. So when you take the tooth, suppose this is the incisor. Okay, the face which is towards the tongue, okay, that is lingual. The face which is towards the lip is called labial. And what we call it as in the table, it's called table. Okay. So that's the shape of the table surface. That is a top portion. And the top portion is very important, because on the top portion only you're able to see that mark, you're able to see the dental star. Okay. So in case of labial surface, means the surface which is on the outside towards the lip. So this galvin screw and also this hook notch is seen. So that's why when you see the incisors, you need to know what is table surface, lingual and labial surface. Okay, so these are the 6 methods by which you can estimate the age. First, let us take period of eruption. Okay, first temporary on the day of birth. Okay, as far as temporary incisors are concerned, on the day of birth. Okay, so already first incisor, milk tooth, is already visible. After 6 weeks, means 1.5 months. Okay, second milk tooth is deciduous tooth. Okay, and on the 6th month, okay, at the age of 6 months, you may see the corner incisors. So generally first, second, third incisors we don't use, but we generally use central, okay, then second and corner incisors, okay. So as far as permanent tooth is concerned, the first central permanent incisor generally it is visible at 2.5 years. Second lateral it is at 3.5, and corner or third incisors 4.5 years. 2.5, 3.5, 4.5. Okay. So there is no much confusion about the eruption of teeth. Okay. So between 4 and 5 years, if it's a male, then tushes are visible. Okay. So this is by what you can say permanent incisors. Okay. So even in the later stage also, based on the sharpness of the teeth also, we can very well tell, but they are all additional information. Okay. They are all additional information. And you need to know that, so suppose 2.5 years, we say that second lateral permanent is at 3.5 years. It does not mean that exactly on 3.5 years second will come out. Okay, it's a gradual process. It may be visible at 3 years, it may be visible at 3 years, 7 months, it may be visible at 3 years, 2 months also. Okay, 1 minute. So this is as far as permanent tooth. Okay, second comes mark or infundibulum. Okay, it is nothing but you can see here mark or infundibulum. So this is enamel. Okay, this enamel, it goes inside again. It goes inside, and in this cavity, okay, see, due to accumulation of digested material, it becomes black. So that's why we call it as a mark. Okay, when you see on the table surface, in the beginning, you may see like this. This is a mark. Okay, this is a mark, center part. Otherwise, you see this part, and there will be wear and tear. So that's why it look like this. It look like this, and this mark is nothing but a depression seen on the table surface. Okay, with a pearly white ring. You can see here also later stage. Okay, because when there is a wear and tear like this, okay. So at this stage, if you see, so it may look like this black mark with enamel ring. Okay, and this blackish is due to the presence of digested material continuously. So this mark particularly, okay, very broad and deep, but with the age, okay, due to wear and tear, so this becomes smaller, finally disappears at the age of 10 years. You see, similarly, you can see at the cross section of 5 years, it looked like this. Okay. At the age of 7 years, it looked like this. Okay. At the age of 9 years, you may start seeing that dental scar that we'll discuss. But at the age of 10 years, this totally goes because there will be continuous wear and tear. One day, this mark depression will go due to continuous wear and tear. Means this is one criteria to say that this mark present from the beginning and it disappears at the age of 10. In the beginning, it will be a deeper, but with the age, this will become shallower. In the beginning, it will be smaller. At the later stage, it becomes bigger. Okay. So this is regarding the infundibulum or mark. Next is a dental star. Okay. The same diagram I'm using it. Okay. So at one stage, so this is nothing but a pulp where blood circulation is there for the whole tooth. Okay. At one time, this will get, due to wear and tear, this part will get exposed. But in the natural process, this cannot be kept open. So naturally, some white material will get filled on its own in the process of filling. And that white filling, okay, it will cover that pulp cavity. It looks like, since it's white, that's why we call it as a star. Okay. Dental star. See here, you can see it. So now at the age of 9, if you take it just started appearing, dental scar. Okay. So this is a mark. You can see here, this is a mark surrounded by enamel. This is a dental scar. Another point is that to differentiate whether it's a dental star or mark, always this mark will be covered by the enamel. But in case of dental star, nothing will be there. So you can see this here also like enamel coating. Okay. The same thing if you see photograph, just I'm showing it. See, you can see it here. Okay, dental star. White part is clearly visible. Okay. The same dental star continue to exist till later, but it start appearing at the 8 years. So now 2.5 years, 3.5 years, 4.5 years. Between 4.5 to 5 years, if it's a male, then tushes will appear. Okay. Then later stage, at the age of 8 years, dental star will appear. By 10 years, the mark what we are seeing earlier will disappear. Okay. So in between, we have an additional supporting document, that is 7 years hook notch. Okay, this is a corner incisor. Due to continuous wear and tear, so it may not be observed in each and every os. Okay, but majority time you may see this type of hook formation in the corner upper. This you must remember, corner upper. That's why it's called hook. Okay, it looks like a hook, and this hook notch may be in the process of establishing, or it might have established, or sometimes it might have broken also. But it is an additional information. Okay, so now we can very well say that if dental star is not formed, but if you see the hook notch, it means that it is below 8 years and around 7 years. Okay, this additional information. Next is Galvin's groove. Okay, where Galvin's groove is found, it's seen again on the upper corner incisor. Okay, where you saw as a hook notch on the same tooth on the labial surface. Okay, first at 10 years, you may see the depression on the outer side of the upper corner incisors like this. Sometimes it's coloration also, but the depression is the main. It start appearing. ठीक है, 15 years के बाद क्या होगा? पहले शुरुआत में दिखेगा 10 साल में, और 15 साल होने तक आधा तक आएगा. ठीक है, 20 साल तक होने तक ये सेम द डिप्रेशन है, इट कंटिन्यू टू फॉर्म टिल द बॉटम. ओके, 25 years के बाद फिर वो बनना बंद हो जाता है, इसलिए ऊपर नहीं दिखेगा, नीचे दिखेगा. ठीक है, at 25 years it is half grown out. It means that after that, that groove formation will disappear from the top. The one which has formed the earlier will be in the bottom part. Okay, at 30 years everything disappears. Though animals may not survive till 30 years, but at least you can make sure that 15 years, okay, confidently you can say that it's a Galvin's groove. Okay, 10 years it start appearing, 15 years आधा हो जाएगा, 20 years में पूरा नीचे तक आ जाएगा, 25 साल में ऊपर वाला आधा गायब हो जाएगा, नीचे वाला रहेगा, 30 years के बाद टोटली गायब हो जाएगा. Okay, that's a Galvin's groove. Now, whatever the parameters we studied, they are the solid information. But sometimes, additionally, other parameters like angle of incidence, shape of the table, both may support to some extent. Additionally, अगर मान लीजिए कहीं confusion है, ambiguity है, you can take little more information based on the angle of incidence. Angle of incidence means the angle formation formed when mouth is closed. Okay, and the angle formed between the upper and the lower corner tooth. Okay, जब दोनों मुंह बंद रहता है, जब दोनों का इंसाइजर जब टच हो जाता है, how much angle is formed. Okay, so teeth becomes longer and projected outward with the advancement of age. Okay? In the beginning it may be opposing properly, but with the advancement of age that angle reduces. So that's why teeth projects outside. Okay, similarly shape of the table, so just in a guidance. Okay, that's incisor 1, incisor 2, incisor 3. Okay, it will be smooth at 6 years, 7 years, 8 years. Okay, star you see vertically. Okay, smooth in the 6 years, stars in the 8 years, round 9 years, triangular 16 years, rectangular 18 to 20 years. Okay, so these are additional information by which you can tell the age of the animal. Okay, so why it is important? Because of this word bishoping. Okay, bishoping is a concept of or manipulation of tooth to make the old os to young by creation of mark on the table surface. ठीक है, मार्क रहेगा तो यंगर एज है. डेंटल मार्क गायब है, इसका मतलब dental star present means old age. So they try to create an infundibulum or mark on the table surface. Okay, by the side of the dental star to make that hearts look younger, just to mislead. So that's why this all old stories.